into insulin resistance. What is it? How do you define it? And who is somebody that knows about this? Dr. Tiffany Marie. This is going to be a great call. So if you are coming into this webinar is awesome. You're going to want to be a part of this live. If you've got questions, definitely put them in here. I'm going to be answering those along the way. If we get some that are coming in, we will certainly put those in the chats. If you've got them, I'm going to ask you to put those Q&A ins during the live, because this is going to be a great way to learn some good stuff. All right. So I'm going to jump over here real quick and get this started, sharing this in this format so you guys get it. All right, here we go. Dr. Tiff right out of the gate. Oh, let's see.
Telling us about his story. When you hear those words, insulin resistance, what are the things you are thinking about? I know a lot of people, because they know about what we do, they have some better ideas. But most people, when they're talking about insulin resistance, they're thinking really just about diabetes, just about sugar. But insulin resistance starts years, sometimes decades before diabetes shows up. And that's where most people are being missed. Now, understanding, insulin's role as a fuel switch. I mean, it literally helps us go from sugar burning to fat burning. And insulin is good. That's a great hormone. But too much of a good thing can be a not so good thing. And so insulin is supposed to be up when we eat and down when we don't. And problems start when insulin stays high all the time. And so if we're going to talk about this, we got to also talk about, what does insulin resistance look like, right? So let's talk about some things. Difficulty losing weight, particularly that weight around the midsection, cravings for sugar and salty, those headaches, those migraines, that low energy, that fatigue, that hard belly fat, okay? Those are those symptoms that we think, brain fog, that may not be anything. Skin tags, how about that? Insulin can act like a growth hormone and make little flaps on your neck. Those are skin tags from insulin resistance. Yeah, if you have more than 5 or 6 of those, dermatologists know that links to insulin resistance. Nobody told me when I was doing primary care medicine, taking care of babies to elderly. I need to know these things. So this is important for us to understand. The dark patches on our neck, that's not dirt. That's overgrowth of skin cells making a dark area because of overlaying skin. Okay? And so these are not random problems. They are different faces of the same root issue. Right. And this insulin resistance leads heart disease, stroke, okay? Alzheimer's dementia, fatty liver, polycystic ovarian syndrome. That's the leading cause of anovulatory fertility, meaning a woman is not dropping an egg type of fertility. The leading cause. Erectile dysfunction, arthritis, and there's more things that aren't even on this list that are linked either directly or indirectly to insulin resistance, even arthritis. And see, we treat those things as separate diseases, but metabolically, they share a common driver. And so how does your doctor check for your risk? Your cardiovascular risk, your metabolic health risk? As a family doctor for 20 years, I relied on the A1C. And I wasn't by myself. But I kept seeing people who felt like they had all those insulin resistance symptoms, but their labs were normal. And they just kept getting worse, needing more medications for other things, for joint pain, for gout, for migraines, even for some of these autoimmune conditions. All these things just kept getting worse. And I knew something was missing. And I was missing a lot. So if your doctor is only checking an A1C, they're missing a lot of things too. The reality is that a normal A1C doesn't necessarily mean you are low risk for cardiovascular disease or poor metabolic health. And I keep thinking everybody knows what this is, but your A1C is actually like, it's a report card for how much sugar's around your red blood cells. Let me just say it simplistically like that. So it's a percentage wise. You have 20%, 20% of those red blood cells are covered in sugar. That's what those numbers are trying to say. Nate, 13% was like covered almost in sugar. That's what that's trying to say, okay?
Right, okay.
And so I'm sure there's some of you on this call who were thinking, I don't have to worry about insulin resistance. My A1C is normal. I don't have diabetes. My doc told me my A1C is controlled. on my meds, but let's talk about something. The American Diabetes Association calls diabetes being managed with an A1C of 7. Now, look at this little picture at the bottom of the screen. Diabetes is 6.5 and above, right? So if managed diabetes is an A1C of 7 and you diagnose somebody with an A1C of 7, that doesn't look managed to me.
It's not
Something
cured.
about that doesn't make sense.
It's not cured.
And then we have evidence that shows cardiovascular risk increases even within the normal range of 5.0 to 5.7. And so this large study followed adults, and that's the study written there at the bottom of that slide, without diabetes, and showed that cardiovascular risk begins rising well before an A1C reaches diabetic levels. So a normal A1C doesn't mean no risk. It often just means insulin resistance hasn't been detected yet. So 4.8 to 5.0, this is a good place to be. You aren't dealing with insulin resistance. Very, very low risk, right? Very low risk for cardiovascular disease. 5.1 to 5.4. Yeah, you're kind of creeping up. There's a gradual increase in risk, and it's about time to start doing some lifestyle changes if you are not.
Right.
And then 5.5 to 5.6. See, this is where a lot of people get stuck thinking, oh, I just made prediabetes. I'm good. I'm fine. In fact, somebody was talking to my mother the other day. Guess what my A1C is? It's 5.6. But here's when things are ramping up, and you really need to be working on those lifestyle changes to take control. And then at 5.7, now your doctor's like, oh, okay, this is prediabetes. Okay, we really got to start cracking things down. We really got to start. In fact, lots of them are even prescribing things like metformin or prescribing those GLP-1 shots because they're trying to help you not get to type 2 diabetes. But I'm a fan of trying to use the lifestyle changes first, which is why I'm here. Now let's talk about how insulin resistance develops, or what this really is. I mean, there's two components of it. Insulin being too high and your cells not really listening to insulin as much. You know why this happens? The body is actually trying to protect itself. And when I say that, people are like, from what? Well, frequent refined carbs results in spikes of glucose. And then you have glycation, and that's when glucose binds to fats and proteins in the body, forming harmful advanced glycation end products, which damage the cells, causes aging to kick off, right, stiffens blood vessels, gives you that saggy skin, virtually caramelizing your insides. And our body is trying to protect us from that. And so when I talk about those refined carbohydrates, we're talking about all that processed foods, all those things that are bagged, barcoded, and boxed. That's what we're talking about. All those things that's not really food. All the time, right? Yeah, that's what's getting us. And then your chronic insulin resistance, and chronic insulin release. So now, since you've had all that sugar, you have constant insulin trying to be released to decrease those glucose spikes. And the cells protect themselves by down-regulating the insulin receptors. That means decreasing how many are on the outside of the cell. So glucose can't get in. See, you need insulin to bind to a receptor so glucose gets into the cell. Without insulin carrying that glucose in there, it doesn't happen. And so your cells, because it's trying to get resistant, it decreases those receptors, making it hard for insulin to work. And so now the pancreas has to release more insulin. It literally tries to bully the cells to respond. During this time, the cells are being stuffed with more and more glucose, and the glucose is not in the bloodstream. But you know what is? Insulin. But you know what your doctor's checking? Your A1C, not your insulin. So You're thinking, well, maybe I'm okay. You're not okay. That's why you don't feel okay. That's why you have all those symptoms. It's because we're not checking what's actually the problem. And then when insulin is high, you get more fat storage. The fat cells release inflammatory markers. And so this results in that whole insulin resistance, ugly sister, chronic inflammation, the joint pain, how it bothers our gut. And then the whole thing that, you eat less, you move more, it should be easy to lose weight. Not if insulin's high, and insulin down to actually tip the needle on that. So after I've talked about how A1C isn't all that helpful, let me tell you some things we need to be paying attention to. So when we're talking about what we need to pay attention to, fasting insulin. And actually, if you're less than, you are Gucci, you are great. You are very likely insulin sensitive. But 5 to 7, there's early insulin resistance starting to happen. 8 to 10, that's really consistent with insulin resistance. 15 is clear insulin resistance, and greater than 25, oh yes, you have severe insulin resistance. But unfortunately, if I have any providers on this call, you know good and well the organizations that we use to test these things have that normal insulin goes all the way up to 2025. So that may account for the fact that so many people are actually struggling with metabolic health. Why there's only 7% that have been documented. I mean, when we do look at a study, 7% of people have been shown to not have metabolic health issues. Well, that's because the labs we're trying to pay attention to actually don't have a good normal. That normal is based upon how society has elevated insulin levels. And so it gives us a bad range to look at. And then you can look at calculations. So when we look at triglycerides divided by HDL, that's your insulin resistance ratio. Reason why this matters is when insulin is high, it increases triglycerides, but it also decreases HDL. So this is a good way to kind of see, oh, is my insulin high? Yes. We have other calculations that do involve having a fasting insulin, that HOMA-IR, that APO-IR. That APO-IR is actually really helpful for hepatic insulin resistance. So even more specialized.
Wow.
Okay? And then some other simple things that anybody can do. You know, measuring your waist circumference is huge because when insulin is high, it's going to store that fat around the midsection. Okay. And then fatigue after meals. I love this one because everybody thinks, oh, this is harmless. We just got past some holidays, and I'm sure some people have actually had that after meal fatigue. Well, that after meal fatigue is a sign that your sugar's gotten too high. And then what happens is because your insulin is already primed and ready to go because it's too high in your bloodstream, it's knocking out that sugar so fast you're dropping low and feeling horrible. So those are good signs to say, I need to get into my doctor and ask some more questions. A CRP, a ESR, those are good inflammatory markers because inflammation is insulin resistance ugly sister. So definitely making sure that's not sitting there is huge.
The ugly sister.
And so this is the method I like to work with my members on. I call it the fighter method. And it's really pretty simple. So strategic fasting. Reason why you want to do this is because actual healing happens when we fast. That's not something I'm saying I'm doing. So no, somebody actually got a Nobel Prize for this. It's called autophagy. After 16 hours, 16 or 17 hours or so to 72 hours, you get all types of things. You get gut cell regeneration. You get neuron regeneration.
That's
you
awesome.
get immune system boosting. Things that we say are not supposed to happen literally happen. Your cells actually get rid of broken processes,
Hey, you,
broken
Kel. Good to see you.
mitochondria, get rid of the pathogens, the viruses. That's the stuff that
Glad you're
happens.
here.
And all we had to do was stop eating, right? But you're doing that because when you're not eating, insulin comes down. But if you struggle with insulin resistance, that's not as easy to do. And so insulin focused eating. Why we want to do that? Because we want to pull away from all those processed foods that have those quick and easy ways to shoot up our glucose and make our poor pancreas have to shoot up the insulin in response. And so the whole foods, getting away from those processed carbohydrates, trying to do more of your low glycemic index carbohydrates when you want to eat them, but mainly focusing on your protein and veggies makes a huge difference in toxin reduction and gut health. And so when we say toxin reduction, things like alcohol, smoking, those things actually increase inflammation, actually mess with our gut. So much so, we need the trillions of bacteria in our gut microbiome to be working at its tip-top shape. We don't need anything coming there tearing it down. Well, those toxins do, as well as the additives in the processed foods, as well as the pesticides. And so there's all these things, all these outside factors that are silently trying to tear us down. So having something to build up our immune system, our gut, our overall health is huge. And exercise. And when we're talking about exercise, yes, I want you just to move, period. But when we do resistance training, the reason why this is huge is because your muscle cells have more insulin receptors on them. And so, like I said, the two big issues with insulin resistance is that your cells aren't really listening to insulin and you have too much insulin in the bloodstream. So if you have more receptors on your muscle cells, you're getting that insulin out the bloodstream so it can stop causing havoc. Because when it's high in the bloodstream, it damages the blood vessels. It causes the high blood pressure. It causes the cholesterol. It causes all these other things way before the sugar, okay? And then rest and recovery. There's some joke that I've heard people say that I'm a rest when I'm dead. No, that's a problem. We shouldn't be waiting till you're dead to rest. We should be living as much as we can right now. One, because when we're resting, that gives us better control over our blood pressure, our sugar, decreases our cortisol levels. We need all of that in order to even help our mental health. We need all of that to improve our total health, our metabolic health. And once I found out about these natural products that actually support all the things that I teach and believe, it became a no-brainer. Female fiber support, which is, like I just said, our gut microbiome, it wants the best food. And unfortunately, the best food isn't in the grocery stores. Unfortunately, it's hard to grow the best food now in the soil that we have, right? Unfortunately, we're going to need some more help. And metabolic supporting botanicals, the The polyphenols, those things are in the yerba mate that have been around for centuries. This isn't new stuff. This stuff was here. It's just in a way that's packaged that actually helps us. And then the gut microbiome support, which I've already said that. And if you've done any study with autoimmune diseases, you know how much treating our gut has actually been shown to reverse even autoimmune conditions. We need our gut working at its tip-top shape. Serotonin comes from the gut. Our immune system boosts because of the gut. There are so many things that benefit our health when we treat our gut better. And then GLP-1. Everybody and their mom has heard about this. You got stars that are all on these shots that bind to a receptor to pretend like they're GLP-1, but we make it in our small intestine. So how about having something that boosts it naturally without the crazy side effects to give us the results we're looking for with our sugars and our metabolic health? So look, you don't have to wait. Insulin resistance is reversible. Nate just said it. And he's one of many people. Once we go through this and we see all these other people with these great results, you'll understand we're just not talking crazy here. Lifestyle changes are essential. Early action lowers health risks, improves overall health. Protective management is the key. The reality is you have not been given, let me say this again. You are not broken. You just haven't been given the right tools, but we're going to talk about the right tools today. Again, you can scan my QR code to actually find me on social media and even a way to connect with me on my website if needed to ask any questions. I am not your doctor, but I'm a metabolic health consultant standing in the gap between you and your provider to help you with the right answers.
There we go. If that was how, would y'all like to see Dr. Tiff again? I can pull her back up to check that out. But here's the thing. When it comes to our health, we're talking what she's talking. Great approach. I always ask 4 questions. How are you exercising? What are your extras, and who are you encouraging? That's where we really want to start. She's got her fighter method. I've got my 4 questions. Let's get the video to jump back in there. So as we kind of look at this, why it's doing, there we go. So how are you eating? How are you exercising? And who are you encouraging? So we talked about how to eat correctly. It was a big part of what she was talking about, and how we do that, how to address what insulin resistance is, how to impact it, and what are some of those things that you're dealing with right down there on the ticker: high blood sugar, high blood pressure, Alzheimer's, PCOS, type 2 diabetes, GLP-1. I'm going to stop right there. When I was diagnosed with type 2 diabetes, I didn't get the information that Dr. Tiff just gave us. That was not information that I was given. I was told to eat less, move more. I was taught that you're really kind of in this on your own. If that was you, type me in the comment. If that was where you were at, you feel like you were just kind of thrown out to the wind. I listened to America's cardiologist who said the other day, I don't have time to listen to your questions and help you. I want to listen to a Dr. Tiffany any day of the week that's willing to give me time to talk to me, right? That's why I became a nutrition coach. Look, I have a master's degree. I was not going back to school to do anything, but I did become a nutrition coach. I did go to school that far, right? Because I wanted some information that I was not getting from my doctor. I wanted some furthering of my education because I wasn't getting what I felt I needed. And what I do now is to share that. So those 4 questions, how are you eating, starts with it. That simple calorie reduction. I teach meal order eating, fiber, fats, and proteins. Fiber, fats, and protein is thing, all right? And to eat in that order will help to impact your overall blood levels, all right? We change that. We change everything about how we're eating. Fiber, fats, and proteins. Change that. Change everything about your profile. You want to lower insulin resistance? That's the best way to do it right there. That's the best way to do it right there. The protocol that she talked about, that reinforces everything. That time-based eating, the tea and the fiber, right? As Dr. Tiff talked about, the tea and the fiber, right? This reinforces and helps when it comes to doing intermittent fasting, doing that time-based eating, all right? We're not saying don't eat things, right? We're not restricting, right? That's where the fiber comes into play. fiber, fats, and proteins. This is Ohio State. This is UCLA. This is the CDC. That fiber is the carbohydrate that does manage blood glucose levels. With insulin resistance, that's the biggest thing that we're dealing with. But we're also dealing with the inflammation, which is what the yerba mate, the chlorogenic acid in here, is going to help with. The polyphenols that are going to help with that. The theobromine that's going to engage our body's anti-inflammatory system. All right. Those are game changers when it comes to insulin resistance. I love how Dr. Tiffany puts it. It's your ugly stepsister for insulin resistance. And those issues is inflammation. So if you're dealing with arthritis, bursitis, tendonitis, all right, you're dealing with issues of inflammation. I was diagnosed when I was 9 with childhood arthritis. I've been dealing with that for over 40 years. The doctors told me back then we need to stop with the seed oils. Now we say seed oils are fine, but you know what? I've been dealing with that inflammation. What is something that you've been dealing with when it comes to, maybe you're looking at that ticker down there below? What are some of those signs of insulin resistance that you have been dealing with? Because if you have, there is an answer to this issue that Dr. Tiff just walked us through, and I want to talk about, and that is natural products that are there for lifestyle, that are nutraceuticals. These are in the provider's digital reference. All right. As a doctor, she's sitting there and she didn't point that out, but it's there and she knows it, that those items are there. My wife, Dr. G, who does this channel with me, all right, Healthy Together and Feeling Great. When we were both diagnosed with type 2 diabetes, it came to this product right here that she found out from a nurse and a diabetes educator. She went to the provider's digital reference, and there it was, right there where she could get the information. There are no contraindications. So if you're on meds, if you're on a GLP-1, this is going to help your body to increase GLP-1 levels. All right, in your body. How many of you have been in here? Your doctor never told you, as Dr. Tiff just said, your body makes GLP-1 in your small intestines. Your body makes GLP-1. How are they reinforcing that? When they put in a resistor agonist, a GLP-1, Wegovy, Ozempic, or any of those things. I've got a couple of videos about that with other doctors. You are in a place that you're not getting what you need. All right. You're basically giving your body something that is fake. It is not what your body needs. And the GLP-1, when you are in a fasted state, is increased by 60 to 70% with this tea. We did that. All right. I don't need a GLP-1 agonist to lose weight. In fact, that's the whole point. And I'll show you. So when I was diagnosed with diabetes, I was 200 pounds overweight. All right. Dr. G and I were both struggling with that. Red face, droopy eyes. Stay focused, right? How are you? Thank you for coming. So this was where I was at. So this was me. All right. I'll blow that up a little bit. You can see the inflammation. When you can make those comparisons, that's what I want you to. Don't look for the weight as much as look at my face. Look at the inflammation change. That's the key part of this. All right. That's the key part of this, is understanding how the inflammation changed. All right. That is that ugly stepsister for insulin resistance. Dr. G, all right, you can see not only the weight loss, but again, the inflammation change in her. All right. Reversing neuropathy, fibromyalgia, all that completely changed. All right. Total change when it came to dealing with insulin resistance. And when the doctors tell you they don't have time to talk to you, that's a cringe. That's probably the biggest cringe that I have seen, is for a doctor to come in and tell me, I don't have time for you. I don't have time to answer your questions. You're forced to come and look for them. That's frustrating. That's really frustrating. So the product, this game-changing product, is what we're talking about, right? Is understanding that this fiber matrix has 7 different soluble and insoluble fibers. 7 different insoluble and soluble fibers. This is going to control those blood glucose spikes that come with dealing with high levels of sugar in your body. We're going to bring down the insulin because the fiber is going to coat the food. But that's not the only thing. It's going to slow digestion. That's what fiber does as well. As it breaks down in the mouth, it coats the esophagus, coats the gut, feeds your gut microbiome, slows digestion, increases already the production of GLP-1. Your stomach's not a blender, it's a bag. We start with fiber, it coats the food and changes the profile of that. All right. It's going to help with the cholesterol levels. This was studied at the Cleveland Clinic, arguably the #1 heart hospital. It was studied at the University of Sydney in Australia, home of the glycemic index, that works like metformin. About fiber works like statins. It works like metformin, works like the meds that are the most popular ones that are on the planet. And it's in the PDR.net. It's in the PDR.net, the very same place that the doctors will go to prescribe medications. You're going to find it right there. The provider's digital reference. It's right there. All right. On top of that, I mean, you think about it. We're spending almost $2 trillion now on medications and not addressing the fact that issues like B12 deficiency are impacting our health, causing neuropathy, causing those vitamins, because we're not getting the extras. We're not getting the nutrition that our body needs. So here's the thing. What we do is intermittent fasting, and we drink the tea because this is going to stimulate our body's natural GLP-1. When we are doing fasting, we're doing it in a timed area. We're going to stop eating around 8 o'clock at night. We don't eat again until 8 o'clock the next morning. I delay when I have breakfast, when I break my fast. All right. What that's going to do is that is going to bring down insulin levels better than calorie restrictions. We've got multiple studies that show how impressive how it is. And when we drink the tea, we just shake it up. We're drinking this. My body is going to make GLP-1 in that fasted state more than any time. So it's going to help with those hunger cravings that I'm getting during the course of the day. All right. We're going to bring down, we're not eating all the time, so we're bringing down that blood glucose spike. Total game changer. All right. Thank y'all so very much. It's good to have you in here today. I'm going to jump off. And if you do want to order, if you want more information, you can message me there and you can start on the protocol. Make sure that you subscribe, and we'll see you back around on the flip side, folks.